Hello, you are welcome to OncoLife interview session. It's my pleasure to introduce our guest today, Dr. Iris Kuss, Vice President of the Global Development Lead in Oncology at Bayer. You are welcome.
Thank you very much. Thank you very much for having me here today.
Thank you for joining us. Today we will explore the impactful results of the ARANOTE trial and discuss Bayer's promising new generation treatment in prostate cancer. Dr. Kuss, could you share some information about your background and your professional journey? Then we can move the information about the ARANOTE trial.
Sure. Yes. So I am a board certified internist. I have worked mainly in oncology in the clinic during my clinical career. So I have my career started in Austria, in Graz, and I have also been for approximately 4 years in Pittsburgh working in translational oncology research at the Pittsburgh Cancer Institute. And since 20 years now already, I have to say I'm in the pharma industry. I've been working on early clinical development and late clinical development. And since 10 years now, I'm working in prostate cancer on the development of darolutamide at Bayer.
And could you provide an overview of the ARANOTE trial, including its design, key objectives, and primary endpoint? How the trial outcomes, particularly regarding the progression-free survival with the darolutamide plus ADT, contribute to advancing the treatment option for metastatic hormone-sensitive prostate cancer?
Sure. So the ARANOTE trial is actually our third trial for darolutamide, and it has been conducted in patients with metastatic hormone-sensitive prostate cancer and was designed really to give patients an additional option with metastatic hormone-sensitive prostate cancer without adding chemotherapy, which was actually our trial, ARASENS. So we have a trial of 669 patients, and they have been randomized to receive darolutamide plus ADT versus ADT and placebo. And our primary endpoint of the trial was radiological progression-free survival. And our secondary endpoints included overall survival and very important other endpoints as time to metastatic castration-resistant prostate cancer, time to PSA progression, time to pain progression, and the time to subsequent anti-cancer therapies. And the results we have seen have been very promising again for darolutamide. So we have seen for our primary endpoint, radiological progression-free survival, a 46% reduction of progression or death, which is a hazard ratio of 0.54. And also looking into subgroups, we can see a risk reduction of progression or death of 70 or 40% respectively for the low volume or high volume disease. Specifically, I would like to mention also our secondary endpoints in the study. We have seen for overall survival a 19% risk reduction of death, and specifically for other secondary endpoints, very important for patients as time to metastatic castration-resistant prostate cancer, we have seen a hazard ratio of 0.4. And also for time to PSA progression, we have seen a hazard ratio of 0.31. This is really showing a clinically meaningful delay for patients that the metastatic castration-resistant state is occurring. And this is actually a state for patients where there are more morbidities and a higher mortality. Also, time to pain progression, very important for patient, has been numerically different and has shown a hazard ratio of 0.72. So altogether, I think an excellent efficacy for darolutamide for patients with metastatic hormone-sensitive prostate cancer when darolutamide is combined with ADT. So really an efficacy shown across all secondary endpoints as well.
Given the positive results of the darolutamide with the ADT, both with and without the docetaxel, how might this finding influence the treatment protocols for metastatic hormone-sensitive prostate cancer?
Yeah, so we have conducted a trial before already, the so-called ARASENS trial, where we have combined darolutamide with ADT and docetaxel and compared it to docetaxel and have shown an overall survival benefit in this trial. With this trial now, with ARANOTE, we have combined darolutamide with ADT only. And this was really to give the patients the best treatment option, a treatment option to combine with ADT alone or to combine with ADT and docetaxel. And this actually is important for the treating physicians to give the best option for individualized treatment. So very important to have options to either combine with chemotherapy or not combine with chemotherapy.
The ARANOTE trial did not include the chemotherapy. How might the absence of the chemotherapy in the protocol alter patient quality of life and the treatment adherence compared to traditional combination treatments? So
with ARANOTE, we have a trial where we combine darolutamide and ADT. And looking at the current standard of cares evolving, it really comes out to that this will be the standard treatment, a combination with an androgen receptor pathway inhibitor plus ADT. And this can then be combined with docetaxel depending on the disease and on the patient needs. In addition, we have seen with ARANOTE as well that we have an excellent safety profile, and this safety profile has been confirmed again, even with now looking at the third study. So we have not seen any new safety signal. Actually, we have seen with ARANOTE that our treatment emergent adverse events have been similar to the placebo arm. So that was really an excellent result. We have seen here also that our discontinuations in the study were lower in the darolutamide arm as compared to the ADT alone arm. And when we look at side effects, which we know are present with androgen receptor pathway inhibitors like fatigue, in this study, we saw a lower rate of fatigue in the darolutamide arm as compared to the placebo arm. So that was a great result, as of course, a treatment for prostate cancer patients, you always want to ensure quality of life for a patient. And having a drug which is well tolerable is key for all the patients and older men with prostate cancer.
Could you elaborate on the ANEQ molecular mechanism of the darolutamide as an androgen receptor inhibitor and how its low potential for blood-brain barrier penetration might benefit patients compared to other therapies?
Yeah, so what we have seen in fact with darolutamide is that compared to other androgen receptor pathway inhibitors, or other androgen receptor inhibitors, I need to say, it has a different structural design. And we have seen a low blood-brain barrier penetration. And we have also seen, most likely due to this structural difference, a very low drug-drug interaction. And now looking into the patient population, which is treated with those compounds and also with darolutamide, we are talking here about prostate cancer patients, older men, and older men with several morbidities. So, you have different morbidities, you're taking additional drugs, and therefore it's extremely important that you don't have drug-drug interactions. And so this means you can combine other drugs patients are taking very easily with darolutamide. So this also gives an advantage for patients to be treated and having no drug-drug interactions. Maybe to add here, when we are talking about the low blood-brain barrier penetration, I mentioned before fatigue, or also we have seen low incidences of neurological side effects. This might be due to the low blood-brain barrier penetration we are also seeing with darolutamide.
How does darolutamide's safety profile in ARANOTE trial compare to previous trials such as ARAMIS and ARASENS? And what implication does this have for the long-term tolerability of the darolutamide in clinical practice?
Yeah, thank you for this question. We have, as mentioned, we have seen extremely well tolerable compound in ARAMIS, our first phase 3 trial in non-metastatic castration-resistant prostate cancer. And we have seen a similar safety profile for darolutamide in our ARASENS trial. Here we have given docetaxel in addition. So we saw, of course, side effects for docetaxel, but for darolutamide, similar safety profile. And for ARANOTE, actually, we have seen, let's call it the best tolerable safety here in this trial. And as mentioned, very similar to our comparator arm, so ADT alone. And I think, again, to mention, we had less discontinuation with our drug, with darolutamide, as compared to the comparator arm. And I think this is really an extremely good sign for this drug itself. So very tolerable. We have patients also in long-term follow-up. We have patients from our previous trials still on treatment in, we call it rollover study, and we do not see any new safety signals, so extremely tolerable drug again. And maybe to mention here as well, we have one patient still on darolutamide for more than 10 years now. So he was one of our first patients entering and starting the development for darolutamide, and he still is tolerating the drug extremely well and is still on drug.
What are Bayer's next step for darolutamide in the term of exploring its use across the other stage of the prostate cancer, or combination with the emerging treatment modalities?
Yeah, so the treatment with such tolerable drugs, of course, you want to delay for each patient to become metastatic, and specifically to become metastatic and castration resistant. So you want to try to cure patients, and therefore we are moving earlier in the treatment paradigm for prostate cancer patients. So we have one trial, for example, which is currently ongoing in patients with biochemical recurrence. And we have one trial in an early stage, in an adjuvant stage, also conducted, which is after in an adjuvant stage. So 2 phase 3 trials currently ongoing in an early stage. And we really hope that we will be able to either cure patients in some instances, or at least to really prolong the time for the patients until they become castration resistant, they become metastatic castration resistant. And what we really want to have is to have for patients living the life they want and ensure the quality of life, that they can continue with the quality of life they are used to have. So this is really what we want to achieve. Of course, we're also exploring combination therapies. So we have other studies ongoing with new other compounds from other pharma companies. We have a phase 3 trial, which is ongoing with the PARP1 inhibitor. We have a trial ongoing for patients with metastatic CRPC with the PI3K inhibitor. And yeah, so this is what we are currently exploring, yes, to combine also with the other treatment mode of actions.
Well, I have completed all my questions, but I don't know, do you want to add some more or mention or underline any point in this interview?
So first of all, I wanted to thank you to giving me the option to talk about ARANOTE and our compound darolutamide or Nubeqa here in this interview. I am glad that it is possible to emphasize here as well the importance for prostate cancer patients to be treated early and efficacious, and actually with a safe compound. And I think this is the most important, to be treated so that patients can really live their life they love, and with the least side effects possible. And this should be possible for all patients. And I hope that we will be able to continue to even develop the drug in earlier stages, and also to find even more treatments for prostate cancer here. Yes, so thank you.
You're welcome. Thank you very much for joining us today, for sharing this insightful information and your expertise.
Thank you very much. Thank you for having me.